Hello and welcome to this short video on eye checks. It is said that our eyes are the window to our soul, but beyond this, our eyes offer a sign into the state of our health. It's also fair to say that for most people, sight issues are one of the scariest health concerns or most worrying long-term effects that can occur from your diabetes. That's so understandable because our sight is so valuable and precious. So in this section, we will talk you through what an eye check is, what the results may mean for you, but more importantly, the small changes you can make to keep your eyes healthy. Your invite for your eye screen is to specifically look for the changes at the back of your eye. We call that diabetic retinopathy. This screening check is different from the normal sight tests you receive along the high street. So it's really important when you do get your invite to go to it or reschedule your appointment to a convenient date. The changes to your eyes may be gradual, so catching it early means treatment can be more effective in preventing further damage. The time interval between your checks can vary depending on your last result. This could be a check once every 2 years if it's safe, or more frequently if there are changes that are needed to be monitored. You may see the letter R or M followed by a number in the feedback from your check. R stands for the word retinopathy. The number next to the letter tells you about the level of changes in the back of the eye. You may see R followed by a 0. This is a good sign, meaning there's no background changes seen. If you see R followed by a 1, that means that the first signs of changes have been identified and your screener will advise you on follow-up. If you see R followed by 2 or 3, this means the changes in the back of the eye will be monitored more frequently and you're likely to be referred to an eye specialist. The eye screeners will look for signs of fluid buildup in the eye, and this is represented with the letter M, which stands for maculopathy. Once again, there will be a number next to it. M followed by a 0 means there's no signs of changes. M followed by a 1 means it's likely you will see a specialist eye doctor. Understandably, all of this can sound quite worrying. And the most important thing to remember is to attend your eye screening appointment so that any early changes are monitored. So what can you do to keep your eyes healthy? The first we have already mentioned is to go to your eye appointments, but also to accept any appointments with a healthcare professional to discuss or check your blood pressure, cholesterol or glucose levels. All of these may feel far removed from your eyes, and we usually think of them in relation to our heart or brain health. But the small blood tubes feeding the eye are particularly sensitive to pressure in the system or sticky glucosy blood. So making changes to what you eat, losing weight, increasing or maintaining activity or stopping smoking can make all the difference for your eye health. So come and find us at Learning Zone. Have you tried our courses, Moving More, Food Hacks or Fake Away Food Hacks? They're all here to help you make these changes.